enter the room.
Hello, examiner. Jameson number 8092627. Hello.
Hello.
Yeah, my name is Dr. Modi, one of the doctors in the GP surgery today. Can I confirm your name and age, please?
Yeah, doctor. My name is Roger Marshall, and I'm 35.
Okay. Nice to meet you, Roger. What should I call you as we converse?
You can call me Roger, doctor.
Okay, nice to meet you, Roger.
And nice to meet you too.
Okay, so Roger, can you tell me why you're here today?
Yeah, doctor. I've been having weakness in my legs over the last couple of few days.
Can you tell me more about this?
Doctor, I started feeling heavy in both of my legs, and I've been feeling tired a few days ago, and it's been getting worse.
Okay, so for how many days?
A few days, doctor.
Okay, has it progressed?
Yeah, it's becoming worse now.
Okay, is there anything that makes it better?
No, doctor.
Okay. Do you feel this weakness in any other part of your body?
No, doctor.
Okay. Do you have any problem with, do you have headaches?
Sometimes, but very mild ones. Yeah.
Okay. Any weakness in your face or numbness?
No.
Okay.
No.
Any problem with your balance?
No.
Any problem with speech?
No, doctor.
Okay. Were you unwell? Were you unwell before the onset of this weakness?
No, doctor, I wasn't unwell, but this weakness and sometimes also, tingling and numbness sensation in my feet and legs, it's really disturbing me.
Okay. So before this numbness started, was there any flu-like symptom? Like, do you have a flu-like symptom before the onset of this numbness, weakness of your leg?
No, doctor.
Okay. Um. Okay. So, is there any other? Do you have any other symptom?
No, not that feels significant. No, doctor.
Okay. Any increase in urination?
No.
Any lumps and bumps in any part of your body?
Nope.
Any fever?
No.
Any weight loss?
No.
Okay. About your general health, are you being managed for any medical condition?
Nothing significant, doctor.
Okay. Are you taking any medication?
None.
Okay. Any allergies?
No.
Okay. Any family history of similar problem?
Nothing significant, doctor.
Okay. Okay, all right. About your lifestyle, do you take alcohol?
Sometimes, but no. No, doctor. No.
Okay, do you smoke?
No.
Okay, what do you do for job?
No, I'm unemployed, doctor. But regarding as you asked me about smoking and alcohol, I feel that I should also mention that I have been using, Vipex for like 100 canisters per week.
So you've been using what?
I have been using Vipex.
Okay. Can you tell me more about this?
Well, it's just for a recreational use. I hope that it is not the cause. I hope that it's not the cause of my weakness in legs.
Okay. So how often do you use it?
Sorry?
How often do you use it?
Doctor, almost 100 canisters per week.
Okay. When was the last time you used it?
I feel like yesterday.
Okay. All right. About your diet, can you tell me about your diet?
Yeah, doctor, I'm a vegetarian.
Okay. All right. All right. Okay. So, how have this thing affected you? How has it impacted on your life?
Yeah, doctor, I've been feeling tired lately, I'm unable to do those work or those activities that I've been doing it in my like a couple of years ago, a couple of months ago. I'm really stressed out. Like it's really affecting my life.
Yeah. Oh, Roger, I cannot imagine how you feel now. This must have been very stressful for you. Okay, not to worry. We are here to assist you and help you. Is that okay?
Thank you, doctor.
All right. So, what worry you the most about this condition?
Well, doctor, I'm worried about the weakness and numbness in my legs.
Okay, not to worry. We'll address all this soon. Okay. What do you hope for this our conversation today? What are your expectations?
Well, doctor, I hope to find out what is causing the symptoms and I hope to get an appropriate treatment for it.
All right. All right. Okay. Just to ask you, have you had any surgery in the past?
No, doctor.
All right. So I want
2 minutes remaining.
I want to examine you now. I'll be checking your general observations. Then I'll also examine the nerves in your body. Is that okay?
Sure, doctor.
Okay. So all right. So having listened to you and having examined you, what I suspect you have is a condition called nitric oxide toxicity. Have you heard of this before?
No, doctor, that's a fancy term. What is it?
Okay. From what you told me that you've been using this canister, and this canister contains nitric oxide, and this nitric oxide can um, it can inhibit the synthesis of a vitamin in the body called vitamin B12, which is responsible for your nerve health. So this is why you are having that weakness. Are you with me?
Okay, okay, doctor,
Yeah,
yeah.
so this nitric oxide can cause deficiency of that vitamin, which is a very important vitamin for your nerves. Are you following?
Yes, doctor.
Okay, so that is why what is causing your problem. Do you have any concerns for me so far?
Yeah, doctor, like, what should I do right now for this
Okay,
weakness? I'm
so
really scared now.
yeah, no, I don't want you to be scared. We are here to assist you. So I'll be referring you to the hospital, where you'll be admitted. Are you okay with that?
Sure, doctor, yeah.
Yeah, and also we'll be giving you, we'll be doing some investigations for you. We'll be checking the markers for this for vitamin B12 deficiency. We'll also be checking for your vitamin level. We'll be doing a full blood count to check for your blood level. And we'll also be doing some routine tests to check your liver and kidney function. Are you with me?
Sure, doctor, okay.
We'll be doing a special test called
Move on to the next station.
Well, that was good. Uh,
Ah.
if it was a live scenario, you could have done better, it was good.
So hi, Dr. Jeremy. It was a really good consultation. But there's one small, mistake that most people do. Is that when did you start your management? Like, were you able to see the timer as well?
Mm, yeah.
So do you remember when you actually started your management?
Yes. Started it around 2 minutes.
Yeah, so that's a very common mistake, and that actually hurts a lot of people, in their management marks. So what you should ideally be doing is that you have to take 4 minutes for data gathering and 4 minutes for management, right? So because there's so much more to do in this particular case. It's not just that you tell them to admit. So there's more. You identified the cause, which is also it's not nitric oxide, it's nitrous oxide. So there's a
Nitrous.
difference. It's nitrous,
Nitrous.
ROU.
Okay.
Yeah, it's
Okay.
N. So
Okay.
nitric oxide is NO. So that is what we give for angina, right? In angina, we give glyceryl trinitrate, right? That is becomes nitric oxide. That is NO. But
Okay.
this
Okay.
particular one is nitrous oxide. It's basically
Nitrous.
it's also called laughing gas, right? That's
Yeah.
yeah, they use it in anesthesia. That's nitrous oxide.
Okay. Okay.
Okay. Yeah, but so there is you identified the cause that it's a recreational use that is causing this. So there's more counseling to be done as well. You need to talk about what are the resources that you can offer, for him to, rehabilitate himself. So there's a lot of things in management other than just immediate management. That's very important in this, right? So also the simulator, the patient was telling you that it's very stressful, which is actually causing him to use more, of this nitrous oxide. So that also that is something that you have to address as well, right? So always try to keep your data gathering to the minimum. So what the major mistake that you did was, after you got your diagnosis, you went at what point did you get your diagnosis? When you asked for the recreational use, right?
Yes.
So as soon as, always remember, in any case, as soon as you reach that particular point where where you're confident what the case is, try to wrap up your data gathering immediately. I know you wanted to do ICE, I know you wanted to ask more questions before moving on to management, but
Yeah.
you don't have enough time. It's all right, because your data gathering, you've already gotten enough marks, how much ever you get. So it's only gonna hurt your management marks for going ahead. So our examiner is ready. I'll just hand it over to her.
So hi, Dr. Modi. So that was a good performance, and I know this was a relatively difficult case because you wouldn't get the the diagnosis right away. You had to ask a whole lot of questions, and only when you ask about the recreational drug use would you understand that this is related to vitamin B12 deficiency. So yeah, this is one of the challenging cases, and that's one of the mistakes or follies that we have. That if we don't get the diagnosis right away, we tend to ask a lot of questions, and that could be something that will just eat up all our our time in management, because you have 4 marks for management, and if you don't get to even say anything for management, you might actually lose out a whole lot of marks over there, because even then, even if you didn't manage to get what the diagnosis is, you can still have a couple of things that you can do for management. You can call your seniors. You can tell him, I'm not sure at this point, but you'll have to wait until I discuss with my seniors. Until then, I can give you some leaflets and pamphlets for causes for limb weakness, or give him like a general idea of what could be the causes ranging from, the most critical to the least critical. So that way, at least you're doing something for management, right? Because there'll be a lot of situations in the hospital that you don't know the diagnosis itself, but you are still required to manage the patients. So you're kind of informing the examiner how you would manage a case if you still don't know the diagnosis. So you would have gotten some marks of management there as well, but sometimes the clues kind of reveal themselves in the later part of data gathering, like doing the examination, verbalizing the right kind of examination. Because in this case, you would have a positive finding for Romberg sign. You would have a positive finding for, hemoglobin being less. So you would get an idea that this patient has neutrophils being hypersegmented. So these are all classic signs of vitamin B12 deficiency. So, low hemoglobin and, macrocytic anemia and hypersegmented neutrophils, those are all kind of indicative of the fact that there is an anemia that's going around, right? So, and if you had to ask any additional questions that you might have missed by seeing these clues, you can still, put in one or two more questions here and there, saying that I'd like to ask you a few more questions before we move forward. Do you take any recreational drugs? But one important thing about asking these sensitive questions are, you should try to signpost, because you will get additional marks for interpersonal skills if you do that, because these are uncomfortable questions to ask. So make sure the candidate or the simulator is not feeling uncomfortable in talking about this, because
Yeah.
actually
Sorry. I wanted to ask a question. The patient volunteered a history for me. They asked about recreational drug. Is when I asked about smoking, and that's when the patient volunteered the history. So there was no need for me to signpost again because he has already volunteered in history. And I now explored on what he asked me, what he
Yeah.
said.
Our patient was very generous this time, but that's not always going to be the case. So even when asking about smoking and alcohol history, you can signpost saying, I'd like to ask you about some lifestyle history, if that's all right, and then go on to asking the questions, because that's also an uncomfortable territory to venture into, right? Like nobody really wants to talk about how much they're drinking or what they're smoking, because that's again that will put them a little uncomfortable. I've come to you for a problem with my legs, and you're asking me about smoking and drinking. Can't you just treat my leg? What if I say something like that? Right? You can trigger anything in a patient. So instead of actually, causing that trigger, you can just signpost so that, if that does happen, you have like a fallback to say that, these are important for my consultation to understand the overall condition, right? So it's always a good thing to signpost, especially once venturing into, territories where it could seem unnecessary, right? Like if you're asking about sexual history, if you're asking about lifestyle history, especially smoking, alcohol, or drug abuse. But every time when you're actually asking about the recreational history, smoking, alcohol, try to also ask about the recreational drugs, because that is a very important clue, right? So yeah, let's get to the case. So you must have already, I'm sure you've used the OSCE workbench, so we've revamped it a little bit. So all the performances that you do would be logged into this my performance log. So it would be stored by date and time. So when you go back to your previous performances, you can see what you've missed or what you've covered. All right. So data gathering was good, but it was long, unfortunately. I know you were trying to rule out a lot of things. So the main thing in data gathering is definitely rule out the most critical things that can be causing this condition. So a couple of things that you can think of is MS. You did rule that out, and you were, GBS, and you were looking for any cancer signs. That was good, right? So once that is ruled out, then you are considered to be a safe doctor, but you still didn't get any other positive sign apart from the weakness, headache, and the numbness, tingling, right? So yeah, over there, I think it was mostly in the lifestyle factor. So he did mention that he was a vegetarian. So basically, there is no, food intake of B12 as well. So there were two factors contributing to this vitamin B12 deficiency, right? So that was also something that you identified. And a couple of blood tests that you could have actually done in the GP clinic as well. You can do CBC in the GP clinic. You can do certain routine blood tests like LFT, TFT. So, try to verbalize them, because if you don't verbalize them, you don't get those findings. So only if you verbalize the test that you want to do, you would get findings for that. So since you did say neurological examination, that's why we had to give you the neurological examination. But it would be more specific to mention lower limb neurological examination, right? Because that is more specific. They would be only giving you tests if you say the whole thing and if it makes sense to them, right? Because if you don't verbalize that on what you want to see, you wouldn't get that particular results. All right.
Yeah, but I talked about the investigations.
Yeah, but try to get that before you say the diagnosis, because that could be your clue. Because over here, the CBC was a very important clue, because this patient had low hemoglobin, which was also one of the indicators of vitamin B12 deficiencies, right? Low hemoglobin, microcyclic anemia, hypersegmented RBCs. But so you tried saying that we would be doing further investigation. So in the GP clinic, you do a certain set of investigations, like preliminary investigations. But to actually get to this diagnosis, it's important to do further investigations like nerve, conductive studies, or you can have MRIs to actually understand the demyelination process, right? So those are the investigations that the specialist does. So in this case, at least the setting over here is the GP clinic. So try to do the investigations that would be possible in the GP clinic, right? All right, so getting to the explanation. Oh yes, so the one important thing about this case is that there are two things to remember. You have to differentiate it from, okay, so he used the word whippets. Whippets is supposed to be the street name of these nitrous oxide canisters. All right, so sometimes they may actually use the colloquial terms, so you might not actually get it. If you don't understand something, you can ask them, could you please explain what that means, right? So you would go a little bit into that, this is the stuff that we use to blow balloons, or that's what we see in cans. You get a better idea about where, what the thing is. So if at all in the examination as well, if you don't understand something, go ahead, ask, definitely don't leave it hanging. Don't, assume things, because that would be actually, you wouldn't actually know where it's heading. So if you don't understand the words, definitely ask. Try to understand what the patient is trying to say. Sometimes even the sensation that they say would be a weird kind of sensation. They say that they might end up saying that I feel funny in my legs. So, you don't really understand what that funny sensation is. So try to get that out of them, ask them, what exactly do you mean by funny? What is it that you've been feeling? Could you explain that a little bit more? Yeah, that's going to really help, because if at all, when it comes to a point where you don't understand something, do manage to get that, point across, like try to understand what he's trying to say, because that's a major clue. Whatever the simulator is trying to say, it is a major clue. So try to understand what exactly they are trying to say. They will have to explain it, because if you ask them, could you please explain that a little bit more, they'll have to rephrase it, paraphrase it, say it in a way that, is, that could be understood. Yeah. All right. So, right. So vitamin B12, basically it causes demyelination, and the condition basically is called subacute combined degeneration of the spinal cord. So it starts by, all the demyelination process in the posterior column. So then that's why the legs are getting affected at this point, and it hasn't progressed anything further than the legs. So it's in its initial stages. But the important things to rule out is any bowel bladder dysfunction, which this patient did not have. But since this is already set in, this is a very important, a crucial diagnosis to actually refer, right? Because this is something that can become irreversible. Anything that can cause irreversible or permanent damage, that needs to be taken care of immediately. So this is another urgent referral case where you would be referring them to A&E, or you could actually refer them to a neurologist who can do further tests and understand how severe this condition is and accordingly treat them. And since you already know this is a vitamin B12 deficiency, you can actually give him one IM shot of hydroxycobalamin, which is basically the treatment in this case. So this is actually available in the GP clinic. So you can actually give him one shot and actually send him, to the referral area.
Yeah, and one thing I noticed is you said we'll admit you to the hospital. Don't make that mistake. You are in the GP clinic, so it's not a hospital. So that is something that they take it very seriously, because if you say something wrong, they assume that you haven't read the case properly. So when you're in GP, you refer them to the A&E, or you send them, ask them to go to the A&E, or send an ambulance to the A&E. If you are in A&E, then you admit them to the hospital. Right? Be very careful about that, because it's called disposition. That's one of the things that they mark you for. So what happens to the patient after they leave your consultation room? So you shouldn't say you're going to admit them to the hospital when you're in the GP. That's very important.
Yes, always see where the setting is. So the question itself will actually have where you are, what your role is, right? So make sure you actually give the management according to that. If you're in GP clinic, you would have certain management that you can actually give and arrange follow-up. arrange safety netting and leaflets and pamphlets. If you are in A&E, then you have the opportunity to actually admit the case if that is required. Yeah. So apart from that, let's look at a couple of things that you might have missed. To stop nitrous oxide use immediately. So you did mention that this is because of that, but that is one thing you have to tell him to stop immediately, right? You've identified the cause, but you have to give it in the management saying that stop using it altogether. This can worsen your condition. It can make it worse. It can go into a state you cannot come back from, right? So you need to give that, very stern and, like it needs to be put across to them that they understand. And in these cases, you can, since it's it's an emergency, you can actually ask for your seniors' help. So do involve seniors, especially when you identify that something is, likely to become an emergency. And safety netting. So if there is any worsening of symptoms from the time they leave GP clinic into going to the hospital, if there is any worsening of symptoms, if there is, loss of bowel, bladder control, to, seek medical help immediately. Follow up. So you have given him a sort of management. You have told him what his condition is. You've told him what to do. Now, after that, you can't just let him be, right? You need to see this patient again because this is your patient. If they have any issues, you are the first point of contact since you're in the GP clinic. So you want to keep understanding how that management went. So you have to arrange a follow-up with them. So 3 things that we always tell all students, no matter what the case is, try to do these 3 things for management. At least you'll manage to bag some marks in doing this. So number 1, arrange a follow-up. Number 2, mention safety netting. No matter what the condition is, tell them what is the other extreme that can happen if it's not treated, or if it's not, or the symptoms that they can experience. And number 3, provide them leaflets and pamphlets. So the best kind of patients that you can have is the patients who are well informed of their condition, right? So that you don't have to keep telling them. So the best way to keep them informed is, provide them the right kind of leaflets and pamphlets and direct them to the websites that can actually give them more information about their condition and how to deal with it, right? So, so otherwise your interpersonal skills were pretty good. I actually liked your interpersonal skills. You were actually very empathetic towards the patient. You were understanding that it was very difficult for him, not understanding why he was having this weakness. And signposting is one thing I would say that, especially while venturing into a domain that might be kind of, that might trigger the patient, try to, signpost before you go there. And the other thing that I would want to say about interpersonal skills is, yeah, I think it just it just slipped my mind. It'll come back to me. So yeah. So main thing, you were reassuring the patient. Also providing them extra information is also very important because that actually shows that you want your patients to be well informed, and that actually contributes to your interpersonal skills. So well, that was it for today. Thank you so much, Dr. Jeremiah. And
thank you.
Yeah, so this is your score for the performance today. And yeah, we have been seeing a lot of your activity on the website, and we are happy to have any feedback. So do you have any feedbacks for us?
Okay, it's a good one. I guess maybe because of the lag, phone lag and all that. I know I would have gone fast if it was physical. At least there won't be phone lag. I would have at least tried to complete management. Yeah.
Yes, absolutely. So you were saying that there is a little bit of a lag with the responses. Is that what you were saying?
Yeah, I said phone lag can also play a factor. That's why I didn't finish. But if it's physical, I tend to finish my management if I'm speaking with someone physical.
Yes. All right, that's good. Yeah.
Yeah, that's actually pretty good. Yeah, all right. So, well, have you had an opportunity to practice with patient GPT?
The AI simulator.
Yes, I have.
And how was your experience in doing that?
Yeah, it was cool. It was okay.
All right, and that's good to hear. Well, if you have any feedbacks and if you feel that it needs a little more improvement, do feel free to tell us, and we'll try to incorporate it.
All right, that's fine, no problem.
All right then, Dr. Modi. Thank you so much for today's mock, and good luck with your preparations.
All right, thank you.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.